Hi, Scott Nelson here from the Clinical Mental Health Counseling Program. An area of specialty in my private practice is treating trauma, including post traumatic stress disorder. The topic for today's training is trauma informed pedagogy. Trauma is about an experience that is physically or emotionally harmful or life threatening and that has lasting adverse effects unless it's worked through and dealt with. And this can impact an individual or a student's mental, physical, social, emotional, or spiritual well being. Trauma tends to tear up an individual's psychological anchors. Now, these anchors are fixed in a secure sense of what has been in the past and what should be in the present. So, a traumatic state will last as long as the mind needs to reorganize, classify, and make sense of that traumatic event. Symptoms you're likely to see in the classroom with a student that has trauma in their background: trouble with focus, attending, retaining, or recalling information, missing classes. Avoidance is a diagnostic criteria for post traumatic stress disorder. Emotional dysregulation, they have trouble managing and regulating their feelings. Fear of risk taking, anxiety that can be a low, moderate, or severe, up to and including panic, anger, helplessness, or dissociation, withdrawal and isolation, and unhealthy relationships. Remember, we talked about how the trauma can tear up our psychological anchors. Well, this is important because our brain is an anticipation machine. It continually prepares itself for the future based on what has happened in the past. So the patterns that we encode into memory actually bias our ongoing perceptions and change the way we interact with the world, how we perceive ourselves and others, and it can affect our behaviors as well. There are basically two kinds of memory: explicit memory and implicit memory. Implicit is the one that plays a role in trauma and PTSD and might be affecting our students. Explicit memory involves pulling specific data into conscious memory. For example, think back. Can you remember the day that you learned how to ride a bike or drive a car? If you can remember specific events, you're aware that you are accessing memory data. This is in contrast to implicit memory, where we are not consciously aware that we are pulling data into the present. In contrast, implicit memory is the proverbial never forget how to ride a bike kind of memory or drive a car or whatever you were thinking about earlier. So, memory files are actually being pulled from data that is stored in the brain, but without a conscious link to specific events in the past. We don't have to think about riding the bike or driving the car, we just do it. This lack of conscious awareness when using implicit memory is what causes many of the problems people with trauma and PTSD experience. The reason for this trouble is that their brains are trying to protect them from a perceived threat, and they're pulling memory files into the present, and they experience these memory files in the here and now without the conscious awareness that they're coming from the past. There are three unique features of implicit memory that can play into trauma, resulting in greater symptoms. First, implicit memory does not require any conscious effort or attention to be created. Second, when implicit memory is active, there is no sense of recall that goes along with it. In other words, we're not aware that we are recalling implicit memories. Finally, implicit memory can bypass the hippocampus. This last one's a big player when it comes to developing problematic symptoms like PTSD after a trauma. Because implicit memory has no link or conscious awareness that is being pulled from the past, students can experience memories as if they're happening now, including sensations, emotions, perceptions, and behavioral reactions. These assume that they have good judgment in the present because of that lack of a conscious awareness that these are memory files. Another player in this traumatic drama is the hippocampus, which is part of the limbic region of the brain. The hippocampus is seahorse shaped gland and it works to make the search engine and memory more efficient. Think of the hippocampus as the Google search engine of the brain. So the hippocampus is the master puzzle assembler. It draws together the separate pieces of images, sensations, of implicit memory into the pictures of factual and autobiographical memory. This is important because this helps people to recover from trauma. Probably the biggest player in this drama is the amygdala, almond shaped glands on either side of the brain that are very powerful. Think of the amygdala as the protector. It uses associations. Anytime something bad happens, it's encoded into the amygdala memory, and the amygdala constantly scans for threats. Anything that reminds the amygdala of that earlier threat, it will fire. And when it does, it's powerful. It does not require the prefrontal cortex. It's constantly learning. And when the amygdala fires, the person has the experience directly as an emotional state, has nothing to do with being rational or cognitive. It's designed to bypass that in order to protect our survival. Students with trauma can experience their fear and anxiety responses rather than consciously controlling them. They will experience it in the here and now as if it's happening to them right now. One of the hallmarks of an amygdala based fear response is that the fear or anxiety or panic comes out of nowhere and completely bypasses the prefrontal cortex. This is sometimes referred to as an amygdala hijack. When the amygdala fires like that, it causes fight, flight, freeze, or faint response. The important thing to understand is that this is involuntary, so we as faculty do not have to take it personally if a student reacts with an amygdala based fear response because it is involuntary. It has nothing to do with their ability to be rational. Trauma treatment has three basic phases: processing and coming to terms with the trauma. That's reestablishing those psychological anchors, making sense of the event, and incorporating it into our overall worldview. Mastering physiological and biological reactions, that's managing that amygdala based fear response that causes fight, flight, freeze, or faint. Reestablishing secure social connections. Trauma informed care as it might relate to students are safety. The classroom is welcoming and privacy is respected. Choice, student has a sense of choice and control. Collaboration, that's making decisions with the student and sharing power. Trustworthiness, so task clarity, consistency, and interpersonal boundaries are communicated and consistently applied. And finally, empowerment, where students feel validated and affirmed by faculty. Consistency, predictability, these are all important factors, and this brings us to boundaries. Cloud and Townsend are the boundaries experts in Christendom. And for a boundary to be a boundary, it must be clearly communicated, ideally in advance, and enforced every single time to be effective, along with an appropriate consequence if necessary. A or B choices can also be helpful. For example, would you prefer to turn your work in on time, or would you prefer the 10% late penalty for the assignment because we understand that life happens? Boundaries can generate some pushback, but they actually provide a sense of security, predictability, and safety. Here's some ideas about how educators can use these principles to help students who have trauma in their background. We always want to seek to empower students and avoid power struggles by using respectful, consistent classroom discipline or boundaries. Students who have experienced trauma can seek to control their environment in order to protect themselves, and their behavior deteriorates the more helpless that they feel. Educators need to express unconditional positive regard to help students build trust and form relationships. Remember the social component of recovery from trauma. Even if a student acts out and expresses hatred or cruel judgments, our response must always be gracious. This can be a challenge, especially if the student is mean, inappropriate, or unfair in judging us. Here's some suggestions. Reflect the student's point of view. For example, I'm hearing you say that you don't think this assignment is meaningful. However, we can combine grace and truth, be kind and fair, yet also assert an appropriate limit or boundary on inappropriate behavior or communication in the classroom. Another thing we can do is ask for an I feel, I want, or need statement. So here's an example of that. I understand you're upset. I care about you and I'm willing to help you figure out how to get the assignment in on time. However, I need your help. Please use an I feel and I need statement. This models reflective listening and appropriate handling conflict while moving the student towards a left brain, more rational response and away from the right brain, more trauma based reaction. For example, here's an I feel I need statement. I feel overwhelmed and I need help with the assignment. So the I feel part's an emotion and the I need or I want part is a behavior. With grace and truth, we can maintain high expectations and facilitate excellence in our students. Remember, grace without truth is problematic, as is truth without grace. Think of grace without truth as faith without works, like James chapter 2 verse 14. Similarly, truth without grace is rigid legalism, and we know that the letter of the law kills, as in 2 Corinthians chapter 3 verse 6. Put grace and truth together, it's transformative, it's supportive, but it's not enabling. Here's a rule of thumb: people don't generally change until the pain of remaining the same is greater than the pain of change. Traumatized people tend to instinctively avoid associated emotions and stimuli. This is programmed in until they work through the trauma. Consequently, some crisis may be required to bring conscious awareness and motivate them to find the help that they need to resolve the trauma. Healthy boundaries, including grace and truth, can assist students with trauma to identify unresolved trauma issues and may motivate them to seek help without re traumatizing them. Educators need to check our assumptions. We also need to observe and question or inquire. So, what we want to do is avoid assumptions. We want to talk to students and ask questions in order to better understand where they're coming from rather than leaping to judgment or making assumptions. We can make observations and reflect what we notice specifically about student behaviors and then fully engage in active listening to the responses. You might try some of these to tease out more information. Help me understand, whatever it is, or tell me more about whatever the topic is that you're inquiring about. The thing faculty can do is to become a relationship coach. We can help students develop communication and social skills and help them cultivate positive relationships. Remember, social support is a big factor in overcoming the effects of trauma. We can also provide opportunities, guided opportunities for helpful participation. We need to model, foster, and support ongoing peer helping interactions, such as peer tutoring, peer support groups. We can also recommend or refer things like the Student Success Center or the Wellness Center in order to provide opportunities to practice academic and social emotional skills. Here's a quick do's and don'ts list. So, do empathize, try to understand where our students are coming from. Do assume that trauma is likely in our classes. There are probably students in there that have a trauma history. Respond to racial, ethnic, and cultural needs of our students. Do develop our own self awareness and increase curiosity about trauma informed pedagogy. Now, the don'ts. Don't do counseling unless you're trained to do so. Don't assess student trauma histories. We can probe and inquire, but we need to be sensitive because if we come on too strong, that can actually re traumatize the student. Don't rigidly rely on methods that you or I like or liked in the past. So we need to be flexible and adaptable. Don't hyper focus on student behaviors because those behaviors are likely coming from someplace like a trauma history. And if it's an amygdala based fear response, it's involuntary. The student is having trouble managing those triggers. And we don't want to ignore equity concerns. The research seems to indicate that given the right conditions, anyone can develop post traumatic stress disorder. So it's not a character defect. And when the amygdala fires, it is involuntary and it can cause emotional and behavioral changes in our students. Hopefully, with greater understanding of these symptoms, we can respond with empathy, consistency, and collaboration to give our students the best chance for success. Thanks for joining me today for Trauma Informed Pedagogy.